And so then supination is going to be the opposite. It's combined motion of inversion, adduction, and plantar flexion. So then you can see here, this would be the right foot from the rear pronation. You have the calcaneal valgus, and then here you have calcaneal varus for supination. And then again, we talked before about where you have closed chain and open chain. Which one would this be, closed chain or open chain? The closed is when the foot or the distal part of the extremity is in contact with another surface. So meaning that it's if it's open like this, if it's just hanging and floating in air, it acts more on its own by itself. Okay? When you have a closed chain where it's contact with the ground, then it's going to affect other joints as it goes up. If you're moving the foot here, just free floating as an open chain, it can move without really affecting the other joints. But when you have closed chain, that's when it's going to affect things going up the chain. So the way that you can measure it in the rear foot, where you're going to look at the subtalar motion just in reference to the calcaneus, is you can measure it here with an inclinometer. So you would go, you put this here, and then you just measure like that, where you're looking at the calcaneus. So that's just in the rear foot. If you want to measure the combined forefoot and rear foot, then you would look at it from here, where you would measure how far this moves away from perpendicular to the long axis of the lower leg. Okay, so here's rear foot, inversion, eversion, and then here's how you would do the forefoot. Okay. You're not necessarily going to have to do it for this class, but if you're getting into, a lot of times if you're looking at feet, we do a lot with orthotics, and you're looking at pronation because it affects all the way up. So you can assess what's going on in the foot. Because of course you're gonna have different normal ranges if you're talking about measuring the rear foot versus the combined rear foot and forefoot. And so this is where this is talking about how to determine what's the neutral for the subtalar joint. And we can go around and demonstrate it, but basically what you're doing is that you're taking this, you're holding on the lateral side, fourth and fifth met, and then you're palpating here at the talus, and then you turn it one side and the other side, and you can feel the dome of the talus on either side. You go back where you get it to where it's neutral. Okay, so you find subtalar neutral, and then when somebody's neutral at the subtalar, their foot might be pronated or supinated. They may have calcaneal varus or valgus. So what happens is that if their foot is in neutral, that's where the ankle wants to be. But at that point, if their foot is like this, then when they're weight bearing, they're going to pronate. So if they have a problem where that subtalar joint neutral is in this position, they put their foot down, then they're going to be in pronation. So that's why with orthotics, and I'll bring some next week, you can look at it, you do what's called medial posting, where you have a wedge on the inside of the foot so that their foot's in subtalar neutral without having to drop like that and pronate. So like I said, that's stuff you don't need to really worry about as far as for the test, but just for your own knowledge as far as understanding it. Because there's a lot of people that have pronation and can benefit from proper support in their feet. All right, so then we talk about the different paired planes, paired movements in the ankle foot. We have plantar flexion, dorsiflexion, inversion, eversion. Now, what's the progression of how you do the range of motion? We talked about this before, right? What do you start with? Active resisted can be general movement, movements, or you can do manual muscle testing. Okay, so you're going to be palpating, looking for, if you have an acute traumatic situation, you're looking for swelling. Again, like when we talked about for the midterm, and then it's going to be the same thing for the final. You go through palpation, and you talk about which structures you're going to palpate. Okay, what are the bones involved? So what bones are you going to be checking? Right, tib, fib, medial arch, lateral arch. So you're going to inspect the arch, either when it's open chain or when it's closed chain. Because when people have problems when they're weight bearing, you want to look at what's happening with the arch when they're weight bearing, not just when they're non-weight bearing. And then you get to check and palpate the different ligaments, finding tenderness either on the deltoid ligaments or on the lateral side, anterior talifib. Spring ligament, we talked about that here. So Achilles tendon, calcaneal tubercle, the cuboid, and then Morton's neuroma, you're going to palpate in between the metatarsals. So basically you just want to cover different bones, different ligaments, muscles, and then, depending on what's going on with the patient, you may be palpating some of the muscles and tendons up into the lower leg. As far as we talked about, with posterior tibial tendonitis, shin splints, things like that. And then neuro, that's going to be your basic same things that you're doing as part of your low back and lower extremity, myotomes, dermatomes, reflexes, things like that. So we showed this one already before. Percussion, basically you're just tapping over different areas to look for, what kind of tissue are you examining with this? Nerve tissue, so either bones or ligaments. And then again, basically you can compress here where you're pushing the tib fib together. So that could check the anterior inferior tibiofibular ligament. So basically you're looking either for nerve tissue injuries, either ligament sprains, fractures, stress fractures maybe. Okay, and then here's the anterior drawer test. So we're checking the anterior talofibular ligament right there. So you can see, and you'll see it better when I lift the leg up here. So see that movement there? So you're moving the talus anterior in relation to the ankle mortise joint. And that's a sign of laxity. So what you're looking for there is anterior movement, and that's what we saw on that. So that's anterior talofibular ligament.